Good morning, folks. Today we're going to talk a little bit about lymphedema. In my presentation, we'll talk about the underlying nature of lymphedema. Most of us are familiar with our vascular system, which includes veins and arteries. These deliver blood away from the heart, deliver nutrients and oxygen to the organs and tissue of the body. They also remove waste products, such as carbon dioxide and other products. It's fairly complex. We're not going to go into the details. The blood is pumped away and then returns to the lungs after the nutrients and oxygen have been utilized in the tissue, and the lungs release carbon dioxide and provide oxygen to reoxygenate the blood. The system's obviously a lot more complex than that, but that's all we need to know at this point. But what is the lymphatic system? Well, if you look at the chart at the beginning of the presentation, it's a complex system. A lot of it's not really visible. Everybody's probably heard of swollen glands. These glands are typically lymph glands. Oftentimes people will notice them in their neck when they have a bad cold or infection in the upper respiratory tract. They can be found in the armpit or axillary region of the body, and they can also be found in the groin sometimes when they're enlarged. Many times this is just a benign process, but it could also be something more serious, such as lymphoma. Again, we're not going to go into these details. I'm just trying to set the stage for how complex this system is. There are also little tiny tissue vessels that connect these regions as a conduit for the immune system to help monitor the tissues and body for infectious organisms such as viruses and bacteria. And these conduits can serve to route immune cells to help ward off and fight infection. There's also a fluid maintenance aspect of these conduits, and this is what we're going to focus on. In addition, the lymphatic system also functions as a waste removal conduit, and it helps transport fat through the digestive system as well. So again, very complex. We're going to focus on the fluid maintenance aspect of this process. As the lymphatic system is responsible for delivering fluids and waste products from the tissues of the body and from the extremities, where it's very apparent, and it returns it into the lymphatic channels, where it goes through the vascular system where blood is transported, and then it goes through the kidneys where the excess fluid is excreted. If this system is injured in any way, such as by a surgical procedure or a blood clot in part of the body, it can lead to a condition known as lymphedema. These injuries can also include surgeries from mastectomies, where they undergo sentinel node biopsy and lymph node dissections, joint replacement surgeries, where large amounts of tissue are cut to get to the affected joint, and there's no way a surgeon can avoid damaging these vessels during the procedure. They're virtually microscopic. They can't be seen with a naked eye, even in a surgery. So it's just one of the prices you pay for these kind of procedures. In many cases, it doesn't cause any problems, but when it does, it can be a lifelong issue. The analogy I like to use for the lymphatic system is that of a storm drain. We're all familiar with our city streets having access points for the water from the street to go down into the underground pipes, which flow towards a river or some other reservoir where the water can be safely channeled away from the streets and from the ground. The groundwater will run off into the street once the ground is saturated, and then it goes down through the drains, and it keeps our streets from being flooded. And we also know that sometimes the streets do become flooded, and this is usually caused by some type of damage in the storm drain system. Maybe it's clogged up with debris, maybe a pipe is broken somewhere and the water can't move forward. It's a very similar analogy. If a lymphatic channel is damaged, the fluid from that tissue around it. For example, if you had a knee surgery in your left knee and your left leg started swelling, that fluid can't go from point A to point B because the conduit or the pipeline between where the surgery was has been broken, and the fluid will stay in the leg rather than move forward into the central lymphatic drainage system. So this leads to swelling and fluid retention in that region. And this fluid is quite complex. It's not just water. It has proteins and other waste products because the lymph system is responsible for helping eliminate this waste from the body. Many of you are familiar with diuretics, or commonly known as water pills. This works well with standard edema, which is essentially water and sodium and some electrolytes. However, the lymphatic type edema, which is known as lymphedema, has a different characteristic to it, and it makes it difficult to manage, and diuretics are not the solution. Unlike garden variety edema, the fluid in lymphedema will not mobilize without more extensive treatment, and we're going to get into that shortly. Some patients have a combination of normal edema and lymphedema. That difference can be distinguished by a simple test, and that's a test of pressing the thumbs or the fingers into the tissue overlying the swelling with some pressure. Normal, regular edema will usually give way, and you can press the thumb down to, say, the shin bone or down towards the muscle, and it'll go all the way down into that tissue, leaving an imprint. With lymphedema, there is a lot of other material in the tissue with the protein and the waste products, and it causes resistance to this kind of thumb pressure, and it doesn't leave as deep of an imprint. It's almost like a doughy, resistant type edema. It doesn't lend itself to pitting, which is known in standard edema. That's called pitting edema, like a pit in the ground. Also, because water follows a gravitational flow in the body, it tends to stay in the legs, particularly when a person is sitting for long periods of time and that fluid doesn't drain out of the body. It remains in the legs because of the force of gravity. Many people will recognize that their legs are less swollen when they get up in the morning after they've had time to lay down and sleep, and that fluid will start migrating back up towards the central lymph channels into the bloodstream, and often it will cause them to have to urinate in the middle of the night because so much of it is drained out that their legs become more swollen, typically related to long periods of sitting, and physical activity is at a minimum, which also compounds the problem. So how do we manage lymphedema? In simple terms, manual and mechanical therapy is used by trained professionals, usually physical therapists. There's a certification for lymphedema specialists, which qualifies them to manage this problem, and it takes a significant amount of expertise to manage it well. These types of therapies help to mobilize not only the fluid but the waste products and proteins out of the tissue. Once these are satisfactorily eliminated or reduced, the manual therapy is no longer needed, and the utilization of compression garments, some people call them support hose or compression stockings, these will be used to maintain the fluid levels and keep them at a minimum. The fluid will never be down to zero, but it can be kept at a level that is manageable and will allow the individual to function. The products that are available for these compression garments are quite effective if they're used properly. There are different levels of compression depending on the amount of lymphedema that the patient has and the nature of their lymphedema. This is determined by the physical therapist or physician based on the patient's condition and their response to the therapy. Once that's determined, the therapist or physician will order these stockings in the specified level of compression, and then these stockings will be worn daily. These stockings are special in that they are considered to be graduated in pressure, meaning that the pressure or tension in the elastic material of the stocking varies along the length of the stocking. For example, the compression at the level of the ankle might be 100% of the actual stocking's compression, and perhaps 70% along the calf, and maybe even a little less as you go closer to the knee. These also come in thigh high. They have compression garments for upper extremities, and the graduated nature of these helps maintain the proper amount of pressure in the tissue to keep the fluid from accumulating. Since lymphedema is a chronic condition, daily maintenance with these compression stockings is considered the standard of care. There is no surgical treatment. There is no pill that will maintain lymphedema. Additional factors that need to be considered with the patient include a reduced sodium diet of about 2.5 grams over the entirety of a day. Rare exceptions where they may eat a food that they enjoy on rare occasions, but they should allow for less sodium in all their other foods if they're going to do this. Regular walking is also necessary to help maintain the lymph flow and to help reduce swelling. In addition to lymphedema, exercises in the upper part of the body as well as the lower part several times a week to help maintain lymph flow so that the lymph fluid can return to the central channels and be released into the vascular system. Additionally, good skin hygiene and cleanliness is essential, as well as moisturizing lotions to reduce the risk of cellulitis and chronic wounds in the extremities due to static buildup of pressure from the edema. Since the skin is the main barrier to prevent an infection such as cellulitis, dry, cracked skin is a risk for cellulitis in lymphedema patients. Therefore, the lotion does help maintain the skin integrity and helps it serve as the barrier that it was intended to be. So now that we've considered these factors, we're going to move on to placing the compression garments, and I'm going to show you with an actual patient the process of placing these garments, which requires a systematic series of steps in order to do it properly and not cause undue comfort to the patient. It's imperative that it is done with the patient's comfort in mind, as patients are often easily discouraged from wearing the stockings due to discomfort when placing them, or even frank difficulty or inability to place these stockings. Therefore, this video is intended to be an instructional video, but also a video that hopefully will bring hope and encouragement to people who have not been properly taught how to don their compression garments. Thank you for your time. I hope this is helpful. Here we are again. We're going to put Mom's stockings on due to the lymphedema, and these help maintain the legs so that they don't get swollen. I'm going to show you the name of the product. This is a German company. The name is Juzo, and I do not share any financial interests in this company. These are graduated compression stockings, and graduated means they don't have the same pressure from top to bottom. They vary so that you get the proper amount of pressure to keep the fluid from staying in the legs. And these should not hurt when they're put on. If they hurt or feel uncomfortable, they're probably not put on right, or maybe she needs more therapy. But right now we've been doing fine. They're to be washed every 2 days after 2 wearings. These are clean as of last night. And after you wash them, the first time you wash them, you need to just stretch them out a little bit like that. Just the first day, not the second. And we'll get the second stocking here and do the same thing. So that just kind of opens up the elastic and makes it a little more supple. So the procedure for this is a little involved. It's not difficult. It just there's a sequence of things that have to occur so that we get the best results. So without further ado, we're going to start with some baby powder. We have some cornstarch-based baby powder. And we'll have Mom put the first leg up here. And put a little on there. There we go. And you always want to move powder or lotion from the foot up towards the knee. That way you're not pressing fluid back down into the leg or forcing it down towards the foot. So it's extremely important. It's very simple. Once you get it down, it's pretty much second nature. You just make sure if you're going to put something like on the back. Usually don't put powder on the back because it just falls off, but I'll just show you if you want to do that. You can do that. Yeah, it's all over my hands now. That's fine. It's harmless. Okay, so our next step is going to be to take the stocking and prepare it to place it on. This is essential. Take your hand and you slide it in with the heel part facing this way and your thumb there. And you want to place your thumb right here at the base of the seam of the top of the heel. You pinch it in like a little puppet, and then you just roll it back out, and then obviously this is going to go on the back side like that. I'll set that aside, then we'll just go ahead and do this other one while we've got them out. Stretched them. Now these stockings last essentially 6 months, and then they have to be replaced because they lose their integrity and they won't be doing their job. So we purchased them from our lymphedema specialist. He's been kind enough to give us his cost for the stockings, which is $60 normally at retail. He tells us they're about $90, so he's been very generous to do that for us. He will also ship them to your home or wherever you would like if you're not here in town where you can pick them up. Okay, so the next step is another important one. Now that we've got this set up, we've got to get this on the leg, and it's a several step process. We're going to stretch these with a couple fingers in there, and we're going to slide it right over the top of the foot and just twist it on like a little cork in a bottle. And this is second step. We slide the stocking up as far as we can. Don't have to push it all the way up yet, but we do want it about a finger's breadth below the back of the knee, and that's good. Another thing you mentioned, these have this very elegant design of the silicone at the top so that these don't slide. They have a good grip, and they actually will stay on very nicely throughout the day. They don't, to my knowledge, they've never rolled off, have they, Mom?
No.
So this is a very good product here. So our next step is we're going to use these Home Depot textured gloves, which is the same type that he uses in his office, and it helps move the material. You don't want to touch the front of the leg because there's not a lot of tissue like muscle or fat, and the nerve endings are close to the surface and it's very tender, so you want to keep your hands parallel to the leg. He used to say, like John Wayne. And you want to start with rolling the heel out, and if you can see, that comes out very nicely. That leaves this loose material. This is overlapping here about 2 inches. Leaves that loose material available so that we can migrate it upwards. This sets up the compression And once we get that up, we can note, I don't know if this is visible on the video, but there's a label under here, and you can see that through the material. Now, once you get it set up here, about a finger's breadth below the bottom and a little bit more to the outer side of the leg, so it's kind of on a diagonal with that band. So you want it a little higher on the outside on women, he said. You also notice there's little dots we've placed on the side of the stocking. There's one on this side too. I won't move the camera, but just take my word for it. And that helps to line it with the ankles. You want that just above the ankles if possible. This is a little bit out of line, so I'll straighten that out. Okay, so our next step is you want to have the proper compression. You need to redistribute this material upward so that it's not all bunched up down here. And as I do this, it takes these wrinkles up with it, and that way it'll have a more even level of compression. And this is probably not going to be visible on the camera, but once you do that also, you'll notice that the label is less visible because obviously the thickness of the material is up higher up towards the label, and then it kind of blots it out a little bit. How's that feel?
Good.
Okay, that's number one. We'll just go through the second one just to give you another chance to observe. And again, I've got a little piece of plastic under here. I need to move it a little bit just to keep this powder from clogging up this carpet over time. And obviously every day you put a little bit on it, you know, you got a big pile of powder down there. You're sneezing all over the place. Okay. We just kind of do that. And this helps lubricate the stocking so that it slides easier, and it's also good for the skin. Now at night, we take these off. You're not to sleep in them. He said once in a while if you forget, that's not a problem, but you don't want to do that on a routine basis. Mom always has hers removed every night. It's very simple. You just roll it back like a banana peel, slide it off. And then again, because of the skin with the lymphedema, it can be hard on the skin. We put baby lotion on it, and it protects the skin. The skin's been doing very well with the lotion. And here we go with number two. Again, we take our fingers, pull it out, and then slide it over the foot, push it towards the toes, and twist it like a cork so that it sets in there right. Pull back the top portion, slide, try to avoid touching the shin so that we don't cause pain. And we're just going to straighten this out and get that with the gloves. Leave that there, okay. And start like we did last time. I'm going to move these, make sure that's going to line up over the toes. Roll the heel section out. That puts a little, gets all set for the foot. And then again, the old John Wayne parallel to the leg, avoiding the shin. And you can see again on this side, we have a little dot by the ankle. This one's a little on the low side. There we go, that looks good. This one, the ankle is about right here. I'll move that up some. We'll slide this and put the label back in there. Okay. And again, making sure that the band is a little bit higher on this side than this side, about a finger's breadth below the back of the knee. And then we're going to redistribute this material nicely. It really bunches up nicely and lays down. And then before you finish up, make sure there aren't any wrinkles on the back side, because that'll cause it not to be put on properly. And I think that's about it. Did you have any anything to say, or did I leave anything out?
We put the baby powder on in the morning and lotion on at night after the stockings are removed.
Right. Okay. And do you feel uncomfortable with these on during the daytime?
I don't even know they're there.
Great. Well, we want to thank our therapist for his excellent work in understanding of lymphedema, and I thank him for being so kind and patient in teaching us this technique. And I've been very impressed, and we're very pleased with the results. We've been doing this for a couple months now, when you talk, including the therapy. So we're not planning on changing anything at this point. Obviously, you have to watch the sodium in the diet. That's important, as that will contribute to swelling in the legs. Okay, thank you, Mom.
So now I can wear my regular shoes.
Yeah, so he basically said with her shoes, if you look at the foot, it's a little higher here now. She has some tennis shoes that have laces and a tongue, and he has recommended that she continue wearing those type shoes, because when she laces it and ties it up, it presses this little bulge and helps mobilize the fluid. Now, she also has therapy that she does 3 nights a week. My wife helps her with that, and it helps open up the lymph channels in the upper body so that the lymph fluid doesn't just stay below the waist, because it'll just go up and come down. This helps move it up and gets into the bloodstream, where it's recirculated out through the kidneys and excreted, and helps maintain the fluid at a lower level in the extremities. Thank you.